Hello everyone, welcome back to the NEET PG PYQ series. Today in this video we are going to learn about the one important point topic from the previous year questions. So it's Edrophonium Tensilon test. So as we all know that Edrophonium is used to differentiate between Myasthenia Gravis and cholinergic crisis. So now we all know that both Myasthenia Gravis and cholinergic crisis can produce muscle weakness and paralysis. So what is the difference between them? Let's understand. In Myasthenia Gravis, our body produce some antibodies. Okay, so these antibodies act against the nicotinic receptors present at neuromuscular junctions. So normally we have a synaptic terminal here, and on the other side we have a nicotinic receptor. Okay, so when acetylcholine comes and bind to these receptors, this helps in transmission of nerve impulse and produce muscle contraction. But what happened in Myasthenia Gravis, these antibodies are produced against this receptor. So these antibodies bind to the receptor and cause that destruction or reduction in number. So now when acetylcholine is released, there are not enough receptor available for acetylcholine to bind. So because of this, proper nerve impulse and transmission does not occur, and ultimately the patient develops muscle weakness and paralysis. Okay, so what happened in cholinergic crisis? In cholinergic crisis, the patient can also develop muscle weakness and paralysis, but the here mechanism is different. In cholinergic crisis, there is excessive acetylcholine because of excessive cholinergic drug effect, usually due to excessive acetylcholinesterase inhibitor therapy. Okay, so there is too much acetylcholine at the neuromuscular junction. So because of that excessive stimulation, the neuromuscular junction become dysfunctional, and patient ultimately develops muscle weakness and paralysis. So how do we differentiate between these two? So the test is called Tensilon test. In Tensilon test, we give Edrophonium IV. Okay, so Edrophonium is a short-acting acetylcholine inhibitor. So in Myasthenia Gravis, what happened that receptors are lost, but some receptors are still available. So when we give Edrophonium, acetylcholine increase and can bind to these remaining receptors. So therefore neuromuscular transmission improves. So improvement in weakness, and the patient muscle weakness improve temporarily, and this effect is very short lasting. So because of that reason, Edrophonium was not used as a long-term treatment. Now what happened in cholinergic crisis, there is a excessive acetylcholine level, so patient symptoms become worse and muscle weakness can increase. So the basic concept is very simple here, that in Myasthenia Gravis there is improvement in weakness, and in cholinergic crisis when we give Edrophonium, there is worsening of the weakness. Thank you for watching.